Hello, everyone. My name is Mark Anthony with Edge on Regen Show, where we get the best of the best doctors in their niche to help you have a better life. Today, I have a special guest. I'm really excited. We have Dr. Gregg Gerstin. He's out of, you can go to alignwc.com, alignwc.com. Today, we're going to be talking about a few things, actually, but that beautiful machine back there, I call it the stem cell machine. There's been a huge buzz on the internet about how this machine is helping hundreds of thousands of people around the world. We're talking from people having back problems for 10, 20 years, and then all of a sudden, they're able to walk without a limp. Or patients with neuropathy. Now they're able to start to feel their fingers. Even people where they've had maybe their bones have been stuck together, and now they're able to stretch. This is huge. So if you or anybody out there that wants to get help, you're going to want to listen to the stem cell machine. So again, Dr. Gregg, thank you so much for being here on the show. I appreciate it.
Yeah, thank you for having me. The opportunity to share about some of the newer technologies that we're using is always something fun for me to do. We like to, in our practice, stay on the cutting edge of technology, implementing the best in corrective spinal care, but also the tools that we use to help people become eligible for that. And for many people, before we can get into the spinal corrective work that we wind up doing, we've got to wind up managing crisis. And crisis shows up in a variety of different ways, and many times we can manage it with the chiropractic care that we deliver. But sometimes these problems have been building for so long and have become so deep and have such a pain reflex that winds up occurring that we were struggling with them. And, we had a few cases where we had referred them back to their medical doctors, to actually multiple medical doctors, neurologists, neurosurgeons, orthopedic surgeons. They've had multiple tests, needle EMGs, and they were really, struggling with it, but they knew and they trusted that what we were doing was helping them the most out of any of the other things that they were doing. And it rattled in my head, and I knew colleagues who were working with the SoftWave machine that we use and getting just fantastic results. And I knew, like, for these one or two patients, that this was what they needed and was missing from what they're doing. And it's been amazing to wind up seeing it. That one of those main people that I was thinking about was a patient of ours by the name of Debbie. She's been a patient of ours for a really long time, and she had sciatica. That's how we described it, because it was pain that started near the piriformis or across the glute and went down her leg for over a year. She'd been under our care, working on it. We had referred her to a neurologist. We had referred her to a neurosurgeon. We had her in pain management. She had gone into some massage therapists and some neuromuscular re-educators, and nobody was really able to help resolve this. And I just said, literally one day after talking with my friend who was using it, we need to have this for Debbie. So we jumped on board with SoftWave, and they have been amazing in teaching us how to use it, what the technology has brought to it. And as a result of it, in Debbie's case, we wound up figuring out that it really wasn't a sciatic issue or even a lumbar spine issue. But in her case, it was problems on her feet that were causing the biomechanical distortion that affected the pain patterns that she was going through. And it was actually David that wound up figuring it out.
Yeah, so we started with the protocols that SoftWave gave us, and targeted what we knew to be sciatica, and we found out that it wasn't getting the results that we really wanted, because we saw in other patients where they're walking away after a couple of treatments a lot better than when they came in. So in Debbie's case, kind of followed the pain pathway all the way down to her feet, and found out that that's exactly where the problem was. And after, say, about 4 treatments, she was able to walk out of the office with no pain, and she actually came back to us. That's the best testimonial. When we don't have to ask anybody anything, she's like, she called us on the phone and she said, hey, is David there? I was like, yes, what's up?
Right. Most doctors would wind up being, oh shoot, what did I do this
time? Right.
Yeah, but she just like said, hey, I wanted to let you know it's gone. Like, I feel so much better. I need to let you know that I feel so much better. It definitely changes the whole aspect of your day when that's how you start your day. So
Such a
pretty
pretty
good.
amazing
That's
call.
awesome.
Yeah.
So instead of asking the doctor, like, hey, can I talk to David, please?
And I'm
No,
cool
we're
with
just
that.
gonna bypass that. Yeah.
Yes, many people, and on many occasions, people do refer to David as a doctor, and he does so much work in our office to help us run smoothly that he knows as much as as I think some of the doctors out there may, that just don't keep up with things, because we just keep moving forward, learning and growing with our practice. And in order to run a practice like that, you've got to as a team member.
That's awesome. You know, it's interesting. The first time that I tried, I just call it the stem cell machine. The first time I tried the machine, I remember I noticed probably within 3 minutes, I felt the difference. And I was like, dude, my back's not killing me. Like, you know, because I have a little slight curve of scoliosis. So I'm always having to just, you know, for working on the computer. And I just noticed right away, just fine. And I'll tell you what, I've seen so many miracles. I call it a miracle because with what that machine does, just with testimonials after testimonials, it's crazy. You know, like we just got done showing all the testimonials, recently just on my own page, and I don't own the machine. I'm always sharing it because people need to know more about this. So what would you say that you're noticing the type of people that are coming in? Would you say a lot of it's mostly maybe 80% neuropathy, just maybe aches and pains? What are you guys seeing?
I'd say that it's a pretty decent spectrum. It's primarily folks that have had chronics, right?
Okay.
Stuff that's been going on for a long time, and they've tried what they feel like is just about everything, and they don't know what else to do. So they're looking for really kind of what's the newest, latest, and greatest. But we have seen, like uniquely, I'll say, into our practice, a lot of neuropathy patients, several of which have been diabetic, some of that have not, but just that sort of shadow feeling in the extremity, whether it's been the feet or the hands.
Right.
And they're looking for answers. And it's been super cool to see those patients wind up being able to feel that area again as we're unraveling things. The other, I would say, three major areas we're seeing a lot of people and helping them with. One has been plantar fasciitis. This is super powerful for those folks that chronically, constantly feel like they're walking on eggshells. They've been given the boot to sleep in, and that doesn't really resolve anything. When we can go in and work on a plantar fascia and on the foot as a whole, we can wind up really seeing the inflammation disappear. It introduces the stem cells, the tissue starts to rejuvenate and regenerate, and that plantar fascia is really gone. The other place has been a lot of shoulders.
Oh, wow.
So a lot of people who have had chronic shoulder issues, whether it's rotator cuff issues, whether it's impingement syndrome, biceps tendonitis, we wind up having to figure it out because a lot of times the patient doesn't know. And there's a few techniques that we go through to isolate the tissues that wind up needing support. And this support really happens fast. Within 2 to 3 visits, patients are seeing about 50 to 70% recovery. And in some of these cases, alternatively, they'd be treated with surgery. So we're helping people to eliminate surgery. Now, once we wind up managing the crisis, we then have to work on rehabilitating and strengthening, and particularly within the shoulder. It's about making sure the rotator cuff is right, and then making sure the shoulder is attached to the torso in the right position. Just because we know as we go through life, we move into this direction that rotates the shoulder forward and causes it to prematurely degenerate. So once we manage the crisis, we work to posturally correct them. And then the last one that we have had a number of people come in with, and we might wind up even rotating this into a treatment experience, has been Achilles tendonitis.
Oh, wow.
So people who have tenderness in the back of their calf, particularly down at the bottom, up and down, that's been chronic and repetitive, has really helped to isolate it. David, what else would you say most of the people are coming in?
I would say that pretty much hits it all. And the plantar fasciitis, a lot of people, like in the case we spoke about before, they attribute the pain to something else. We had a patient just Thursday who was here for chiropractic portion of her care, but we brought her in here to see if something else was going on. She describes it as knee pain. And before we start the treatment, we walk her through what's going on. And we realize she's on her feet 6 hours a day in shoes that she shouldn't be in. And, she had some sort of insert she had gotten somewhere. but it wasn't stabilizing her feet. So we walked down, and that's the great thing about the soft wave machine. We can walk down the places of injury that you think are the problem. And what you'll see is there is no reaction. But when we hit the place that is the point of interest, we get that activation of that pain pathway, and then we can start the stem cells going to that area and already helping her out. 'Cause she walked out of here just yesterday, like on her toes, happy. So
And the kind of cool part about it is this patient is a pharmacist.
yeah.
So it's super cool when we can have someone who is in a lifestyle that's very different than this technology would wind up expecting, and they are embracing of it. And they're like, wow, we need this, we need more of it. And more people need to know about it and help us spread the word about it.
I love it. And it's funny, the word regenerative medicine is becoming known now. The word, people are like, it's funny. A lot of people don't realize that it separates, it separates the boys from the men, because the regenerative medicine, what I love about you guys is you guys think outside this box, especially we're in a box right now, this video. You guys are outside the box, and you're willing to explore and to do whatever it takes to get people to wellness. You got so many people on the internet talking about money, wealth. But it's like, no, the number one thing you should be focusing on is your wellness, and then other things. Would you say that the reason why you're seeing a lot of people that are getting better through this machine, would you say that it helps immensely with the blood flow? That's why they're able to get out of that pain right away. What are your thoughts?
Yeah, David's got the explanation that he likes to share with patients. So why don't I let him share that with you?
Awesome.
So really what it is that we're getting the right fluids to the right area. Basically, this machine is using a pain pathway to have a trigger your body into moving the right stem cells into an area of inflammation or injury at a rapid pace. And that stem cell aggregation at that specific area of injury, it comes along with blood flow, and you'll see that immediately after you treat an area, you can see a rosy complexion on the area, because we know the fluids are coming all through your body and getting to that area. But it also helps stabilize inflammation, and that's why when the patient walks out of the room, they're already feeling a lot lighter than they did when they entered. So it happens very rapidly, and so the technology is utilizing certain protocols, yes, and we know what they are and we set them ahead of time, but it is getting the right fluids to that area. And we just read an article the other day about how a macrophage interaction at different frequencies helps create the movement of the right stem cells at the right time to that area of injuries, and we use those protocols every day.
I like
One of the cool things
I like
about
this, how you brought that
technology
up,
as
basically
well.
saying it could breathe.
Yeah, it can breathe them. And the cool thing about this that some of our colleagues in Europe are using it for, and they actually require from their patients, is that when you receive treatment for this, the treatment may take anywhere between 4 to 6 weeks to receive for a typical program. However, the stem cells are continue to grow, aggregate, and increase over the next 12 weeks. So when someone goes home after they've had this, they feel great and they do great, but the true healing process is continuing well after the treatments are delivered.
How is that? How is that? Because, let's take a step back before going to health. You're mentioning stem cells. So can we talk a little bit about that? Like, where does that come in place? I noticed you mentioned the stem cells. Do the stem cells come back alive, or how does that work?
Well, so as we wind up utilizing the acoustic shock sound waves, they wind up causing a little bit of some irritation to the area. And the irritation is typically what's needed to, I'll call it, wake up those stem cells and start to get them going. So once they start to wake up, they're then in the area where the tissues can wind up differentiating. And that time frame for maximum potential translation, that's what doesn't happen for up to 12 weeks.
Okay, awesome. That makes sense.
Okay, so we have a colleague in Europe that does this, and he requires his patients to receive no other treatments besides the soft wave for 12 weeks. Because what can happen is that we deliver the treatment and we see that initial response. But after about 8 weeks, right, you might have tenderness, you may not, and you want to try something else. And then you give credit to the wrong thing for the treatments that are still occurring.
I see. That makes sense. So if I were to come in, let's just pretend my knee was bothering me. How would that look? I come in, do I have like an 8-week treatment? I come in once a
It would all
week.
depend on what's going on and how you respond, right? And what like factors are contributing to causing that knee pain. We obviously go through and we do a detailed timeline history to understand how did this break down? What did we do to get to this point? We look to understand, are there any structural or stability issues that we need to be aware of that we're looking to focus on and treat. We look above and below that individual joint to make sure that we're at the right spot. Then as we're delivering the initial treatment, we're really looking to understand where are our points that we need to focus on. That's our first beginning, I'd say fifth of our treatment. Figuring out where is the tenderness and inflammation triggered within the patterns that we see from, let's say, a knee injury. Right. And then from that, we're going to deliver a treatment. We typically look to wind up delivering our full treatment plans over 6 weeks. We found that to be the best success. Now, that means that you wind up receiving a dose twice a week for 2 weeks, and then typically once a week for 4 weeks. And the doses wind up helping that process to continue to stimulate. And it allows for us to see if there are any compensations going on. So from treatment 1 to 2, we may see that the initial complaint winds up minimizing, but you've got others that are continuing to break down. Almost as though like our story with Debbie, where we wound up primarily focusing on her SI joint and on her piriformis to begin with. But when we saw that those weren't getting us the response that we needed, we looked at the compensatory points that may be effective so that we could get the right treatment for the right person at the right time. Rather than racing to do it all at once.
Wow, that's amazing. So are we gonna be able to see how this machine works, or?
Yeah, we are. So you guys know, is it okay if I share a little bit about your history? Yeah. So David was a college basketball player, and his career ended actually because he had tore his Achilles tendon. So he has had it repaired, but it winds up still having inflammation and scar tissue that have developed. And as we talked about earlier, that's a common place that we've worked. Maybe we know why now. When you have something, you wind up finding a lot of people that do. What I'm going to go ahead and do, David, is have you take the approach on the position that you found to be your best treatment. I think it's face down. Why don't you spin around so that we get your foot further back here. And then I'm going to put a bolster up here just to help you get comfortable. Which leg was that? I'm going to take your shoe off. Awesome. It's the one toward the camera too. I'm going to take your shoe with your sock off just because we're going to get messy. Now, by messy, I just mean we use ultrasound gel to help conduct the sound waves. However, for many docs out there may be familiar with ultrasound, the treatment winds up being delivered it sounds similar, but delivered very differently. Ultrasound, you've got to keep moving along the area, whereas with this, we wind up actually looking to find the spots and stay on there. One of the things that we are going to look for when we find a spot, it's going to be pretty tender. Okay, that's a sign that you're a candidate for the care and that you are responding the way that we need to for this. So I'm going to just move the gel around a little bit. Typically with the Achilles, I like to put this around my neck. It just keeps it in a good spot. David, we're going to get started. Let me know when you feel anything. So as we're getting started here, I'm just kind of scoping along the sides of his Achilles. David, let me know when you feel anything.
Right there.
Okay, so what I'm looking for is for him to feel tenderness based off of the shocks. Now, do you see the lights going on by his foot, or is it too far away from you?
No, I see. Are you electrocuting him?
No, we're not.
I'm playing with you.
Those are actually sound waves that are creating light, so they're really powerful. And what we'll do is we'll just keep it there. Are you doing okay, David?
I'm in there.
Okay. So for David, he knows what to expect, but I was just stayed on the trigger, and it gets to be more as we move down to the insertion point.
So
is that about right, David?
Yes, sir.
So guys, Dr. Gregg and David, so people can't really hear it as well, of course, but maybe if you can let them know that he is feeling it. And
okay, yeah. So David, when you heard each of those taps, what were you feeling?
So I would describe it like somebody taking a tiny hammer and just tapping on those trigger points. I know I'm off camera right now, but basically what you feel is like a little bit of tenderness on that point. The point is definitely not to keep you in pain. We want to operate right around at a 6 or a 7 for the treatment.
Out of 10.
Out of 10.
We're constantly in communication. You may have heard me or
Yeah.
not heard me, checking in. David knows the levels that he's looking for in pain to make sure that we're not getting too high. Now, as we do this continually on him over the treatment, it's going to hurt less and less. And what we'll do is we'll stay on that point for a few seconds and a
Okay.
few shocks.
Okay.
Then we'll move off and then we'll come back and it'll be way more diminished. That's a sign that we're moving in the right direction, that we're starting to get that acute pain reflex that we want, so that we can see the stem cells coming into the area, so he can get relief and start to get healing to the tissue.
Awesome. So this is good, because I just want everybody to know that when you're feeling that, because I went through this process, when you're feeling that, you're going to call it, you're going to feel it, and it's going to feel a little bit of raw, almost like a raw feeling. But here's the beautiful thing is when they're done doing that, when they take it off, you're like, I don't feel pain. Like your pain is literally almost gone. That's what I can say for myself, but go ahead.
Yeah.
The way I kind of described it, I typically do this on my feet. I've had chronic left foot issues, is I feel as though, like, while it's getting done, it does feel as though like you're smashing the bone.
Right.
But when you stop it, it feels as though there's nothing.
Exactly.
There. There's nothing there at all. So I'm going to do about 10 more, and I'm going to ask David, when I go to that same exact spot, is it still a 6 or where is it?
Okay.
Okay, so I'm right about that same spot.
That's about a 4 or 3.
A 4 or super. So what David just shared with me was that 6 out of 10 went down to a 4 out of 10 in just that short period of time doing this treatment. Now, for our patients, treatment wind up being a bit longer than that. But I wanted to be sure to share with you guys a little bit of an example. Dave, you want to step
the foot wants more. The foot wants more. It's just
the foot wants more. And maybe when we're off camera, we'll finish it up and deliver him a full treatment. That wound up being about a quarter of a treatment that we would typically deliver for a patient, in helping to allow for them to start the process of turning over those cells and getting back to their life.
That's awesome. So would you say you spend maybe 20 minutes per person average, or what would you say your average is? Because I know everyone's different. They can come with knee, back. It doesn't, everyone's different.
Yeah, so it depends on the individual. It depends on the region, but typical treatment times here in the office, if all they're doing is soft wave, the initial one takes longer, but after that, it's between a 15 to a 30-minute visit we like to schedule.
Oh, wow.
Just to allow for them to get the treatment that they need. I'm always a fan of giving you back more of your life than I expected, than taking more than we expect.
I love it. So let's say you're done with the 6-week average. We'll just say 6-week. You give them a 6-week schedule. We're going to help you for treatments. What does it look like for tune-ups? I always look at it like our cars. This is our vehicle, our body. So do you guys have like a tune-up? How does that look every 3 months?
So, all patients wind up being different, but we have this one patient that we've been working with who's had chronic lower back pain, and she has difficulty with sitting for more than 30 minutes, and that's what she does for her work.
Oh, wow.
So we've worked her through a program of care. We went through the 6 weeks, and she was able to sit all day. Wow. And doing fantastic. Now, we recommended that she do her next dose 2 weeks later. Right. So instead of going cold turkey, spreading them out. Now, she heard from friends that use a different tool that you can't do that. So instead of asking the doctor the recommendation and following it out, their friends said that. So she had a visit 3 weeks afterwards that she came back in, and she was frustrated because she had a hard time sitting. So we're going to reintroduce a dose, and we should just be able to have to do one this week and one next week to get her back to that maintenance dose of every other week, and then spread it out from there. What we're finding is, especially on bigger joints, right, like the SI joint or lumbar spine, we're needing more of that. In places more of the Achilles tendon or on the plantar fascia or the knee, we're needing less of that. But on the shoulder, I think we're going to need more of that, just because of the looseness in total that the shoulder winds up having.
Oh, wow. That's awesome. So, if you could say the number one thing that you're noticing in your clinic, when you got this, did you notice the difference right away, or was it something that had to kind of grow in the clinic by having this new machine here?
Well, we were really excited about it, right? So when we got it, just because, it was super awesome. We did a big discovery day. We spent a day, and that's all that we did. We came in on a Saturday. We got breakfast. We had a colleague of ours in from New Jersey who has been using this for 7 years, as one of the trainers and one of the top educators on it. He joined us for the day. And we just were going patient to patient to patient to patient. And it was amazing. I mean, the arms that were going, like coming from this to raising the roof, the folks that were walking out without any problems. So we launched it kind of big and kind of focused, and it was really great. And since then, we've continued to pull patients in from our practice that we wind up connecting with that have episodes, and the community has really been looking for it as well. There's a large population that are looking for help from different methods that haven't had success in the past. So we're seeing it come at us from all different directions, but we launched it heavy in our practice.
Wow, that's amazing. So I would say my next and final question would be, what would you see that are maybe like the top 5 things that you're seeing that people are coming in the clinic from, whether it's neuropathy, whether it's plantar fasciitis? What would you say that the from 1 to 5 that you're seeing, or 1 to 7, whatever your number you can kind of come up with?
Yeah, so I mean, obviously, some people are just coming in to see software, like the tool we use, the actual brand, like that's what they're searching for.
Wow.
But in terms of conditions that we see coming in, neuropathy would probably be the highest one. This group, they're just like strung out of luck. They don't have any answers.
Wow.
So neuropathy, then it's probably going to be sciatica. After that, it probably would wind up being foot issues. I'm just going to collectively put them together because the patient might say this, but it's that. And then overall joint pain.
Oh, wow.
Shoulder, knee,
multiple regions and multiple areas, and just people not knowing where to go.
Now, is this affordable? Like, and I have to say that because, I know that, some people get stem cell shots, they're going to pay like, $5,000 and they put a shot in them. And again, I'm not saying this is a shot. This is not a shot. You're not getting any.
Yeah, it's totally not a shot. So in terms of comparison to stem cell shots or treatments, this is massively affordable. It's a fraction of that cost, $5,000 for a full treatment plan, and it's non-invasive. It winds up being safe. It winds up being utilized just about on every and all patients. I mean, the only contraindication for care, the most significant one, is that we can't provide treatment for anyone who has had steroids in the last 21 days. So that's a contraindication, just because the pain reflexes wind up being modified. So we're not able to get the response that we need to deliver the treatment. We can cause more damage. So I think it's massively affordable compared to stem cell injections, compared to joint replacement, compared to physical therapy, compared to pain management. It's massively affordable.
Massively affordable.
Oh, wow. Okay, that's awesome. So Dave, has this helped you a lot to where you can go back and play basketball again?
Yeah, I already have. So one of the things is when I tore my Achilles, it really became a fear, to be honest with you, because I don't know if anybody's had this, but I wish this not on my worst enemy, but it's about a 6-month recovery time just to walk without something on your foot. And then I would say about a year's time to get back to normal, because you have much muscle atrophy. You have compensation on your other leg, where your other leg has put so much pressure on it. This actually got me back in the gym, where I'm actually playing basketball, planning on joining a league this summer, which is awesome, because it really is a fear, because I didn't necessarily do anything specific to cause it to pop. It wasn't like I got hit by somebody. And so in the back of my head, it's like, I could easily do this again just by running up and down the court. That compensation is gone. The flexibility is way, way better. I don't even, if you could say 100%, I would say 100%. So
that's amazing, especially, I mean, I think half the battle for you, correct me if I'm wrong, I used to be a tennis pro, so I understand the whole injuries, and in the back of your head, you can have that fear, just a little bit in the back of your head. And I'm sure that's kind of taking that away now.
Yeah.
They're like, if something happens, I'll get better.
Yeah.
Right. We just did it with the stem cell machine.
Exactly. Is there, to throw this out there, I don't know the exact teams, but I know there are a lot of teams like football and basketball that are starting to utilize this machine. I mean, they're taking it with them on the road now. You know much about
Yeah,
that?
so we're in the Chicagoland area. We're in a town called Northbrook. It's just 10 minutes north of Chicago. And here in Chicago alone, one of the major universities, Northwestern, they have one unit. The Chicago Cubs, they've got 2 units.
Nice.
The Bears, I believe, are using it. And I don't think the Blackhawks are. That's why they stink, and the Bulls are not either. That's why they stink.
Man, you're hilarious.
I'm just kidding, because the Cubs, they stink too, although I love them. So around our area, there are a tremendous amount of high-level performance athletes using these, and around the country there are. There are stories that they brought one to Beyonce.
No, I heard about that one.
Has in her home. I mean, it makes sense. But there are in most NBA locker rooms, they've got one of these units right behind me. They're also using it. This is kind of unique and different. And Tom Warwick, one of the founder of the company that we use, he's using it in open heart surgery, or they're exploring using it in open heart surgery. We don't do that, but that's one of the tools that ways that they're thinking about using it to help in improving outcomes. But yeah, there's a massive draw for this from professional athletes, from weekend warriors. They're hearing about it and wanting it too. And we're seeing the response that they're getting, keeping them on hockey, keeping here in our area, keeping them in hockey, keeping them on skis this time of year, and
amazing,
loving it.
It's awesome how this machine has made a big splash. I mean, just the last couple of years, it's getting to the point where I'm seeing it everywhere on Facebook now, of course, Instagram, all those social sites, and I also know that there's a website. I don't know the exact website, but like if somebody wants to know if there's somebody in the area that let's say if I live in Portland, Oregon, which I do, I can type in Portland, Oregon to see who has the system. I don't know the exact website yet on that.
I think the main one winds up being, I'm gonna destroy it, but there's a couple of them. If you wind up Googling soft wave therapy, that'll take you to their main site, and on their main site they do have a doctor's directory.
Yeah, that's awesome. I love knowing that they have that directory, because they're making sure that they're able to take care of people. I have a friend who's up in California by Santa Barbara, and he's thinking about getting a knee, something with his knee. He's like 46, his knee's been giving him problems. I was like, bro, you got to go check out something. I gave him one of the doctors out there. I go, before you get cut up, come on, man. You're worth more.
It just makes sense.
It's like, just because you have insurance, and the sad part is like, people are so quick to go get, I hate to say it, but I've seen people are so quick, to hear surgery. Okay, I'm going to get cut up in my leg. It's like, try this first. And that's my thing to everybody. If you're out there looking at your doctor's telling you, hey, you're going to get surgery, try this first. I'll make sure that I have that link down at the bottom so that everybody can see if there's a soft wave in their area or a stem cell machine in their area. If there was one thing that you would leave with people that are not sure, maybe that are kind of even on the fence, or what would you say? Either one of you.
To me, the biggest thing about using the soft wave therapy was that the idea and the principle that the safety of the tool, right? That was like, wow, this is a really easy and safe thing to wind up using. The second thing is that when we deliver our first treatment, it winds up being diagnostic, right? So we've had patients come in that don't get that tenderness point. And if you don't get that tenderness point, that response, then we know that you're not a candidate for this. And we've got to explore other options. So for me, the idea that the treatment was therapeutic and it was diagnostic made me so confident that I could wind up administering this with confidence. And when it wasn't right, we'd make sure to get the patient to the care that they need. Because as much as I think that this is something that we all can wind up using at some point in some place, well, I mean, there's no magic potion or lotion in healthcare. There's no one single magic bullet. But when you have something that is non-invasive, when you have something that has no or minimal contraindications that you can wind up delivering affordably, it just makes sense to give it a shot.
Yep.
I love it. I agree. And wow, that's just an amazing tool. It's been a while since I've used it. I'll be using it real soon. I'm actually looking at reconnecting with Dr. Matt Dodoria, good friend of mine. And,
Super. Well, yeah, let's get you reconnected with them. I know Portland is looking for some support. I've got another friend out there in Portland who's been asking me how it's been going. So there might be a couple of them out there.
Yeah, there is. It's trying to get something a little bit closer because I'm in Vancouver, Washington. Not
Okay.
British Columbia, but 20 minutes from Portland. But I just want to thank both of you so much for being here on the show, and everybody in internet land. Remember, sharing is caring. Remember, one video can change one person's life. So let's make sure we share it. Let's get the love out there, and make sure you also take a look at Dr. Gregg at alignwc.com, alignwc.com. Thank you so much, Doctor, and David. Thank you.
Thank you as well. Thank you for sharing this.
Have a good one.